H.E.A.T. Signal Insights. The 7 minutes that decide everything. Your ED team has 7 minutes per patient. Emotional distress needs more, unless the tool does the watching. Here's a number that should stop every hospital leader in their tracks. 7 minutes. That's the average direct physician contact time during an emergency department visit. 7 minutes to assess, diagnose, and begin treating a human being who may be in the most distress of their life. And nursing teams, managing 6 to 8 patients simultaneously, face an observation gap that's even wider. In that math, something has to give. And what gives, almost every time, is the emotional layer. Because here's what hospital intake looks like in practice. It's verbal, it's self-report dependent, and it's conducted on patients who are under acute physical or situational stress. The exact conditions that make human beings the least reliable reporters of their own emotional state. The consequences are measurable. Patients who present physically, but are in acute emotional distress from anxiety, grief, trauma, domestic violence situations, or active psychiatric crisis are routinely underidentified at intake. The result? Inappropriate disposition, premature discharge, preventable readmission, and in the most serious cases, patient safety events that weren't caused by clinical negligence. They were caused by clinical math. One 6-week ED pilot with H.E.A.T identified 12 patients with emotional distress that standard intake missed entirely. 3 of them were at acute suicide risk. 12 patients in 6 weeks at a single institution. The question worth asking isn't whether your clinical teams are skilled enough. They are. The question is whether the tools they're working with can keep pace with the volume to clinician ratio that modern healthcare demands. H.E.A.T functions as a passive, continuous, emotional state, monitoring layer integrated into the existing clinical environment, adding an objective data stream to clinical assessment, without adding a single second to clinician workload. Because when the average ED visit is 7 minutes, your tools have to do what your team no longer has time to do manually. This is H.E.A.T Signal Insights. New episode every week. We'll see you next time. See what others miss. Change what matters most. Want to learn more? Just scan the QR code in the corner.